this is the insulin needle, and the expiring date will be somewhat here. So when you take this off and then you screw this in, observe, you screw this in and then you take the cap off, you will observe very well that you cannot see any needle anywhere. You can't see any needle anywhere. But by the time you are administering to the patient, obviously the needle will come out and it will retract on its own and activate its own safety lock immediately you are done. So this is very, very advanced. So you don't know the needle you can find in your assessment day. So we always recommend that before you go ahead and write your exam, always come for the physical assessment so that you can be able to get yourself acquainted with whatsoever you can find. You don't want to be taking unaware. Okay, welcome back once again. How are you today? Welcome to EMGS OSCE channel, where we make OSCE easy for you. We want to simplify it for you, make the journey as easy as possible, as easy as you can get. Welcome on board to the Express channel. If you are joining us for the first time, we make videos here to help in guiding you through your OSCE journey. These videos are not replacements of our classic lectures where we are much more detailed, but it's sure we supplement the lecture and helps in guiding you and be able to smash your exam. So what we are going to be dealing with today is administration of insulin or subcutaneous administration of injection, or we are going to be administering injection subcutaneously. So I've got the nurse who is going to be performing this procedure, and I'm going to just be playing the role of the assessor. Mind you, in your exam, you might not necessarily have all this preamble from your assessor. The assessor is just going to welcome the candidate on board and then say your time start now, some few things to the hearing of the candidate, and then the whole scenario can start. So I'm going to be calling the candidate in now. Just watch your along with us, jot down a relevant point and learn. And at the end of this session, I'm also going to give you further feedback as in regards to how best you will be able to approach this scenario and a few things you should always remember. So with that being said, are you ready for me?
Yes.
Okay, you can come in now. Okay, so you are going to be performing this procedure, administration of insulin, and you are going to be doing that subcutaneously. Again, as I told you before, the assessor will not tell you. The question will be there for you to see. It's just to carry you along. The timer is right here. Everything you need for this procedure will be provided before you. Can you confirm you do not know the assessor today? Can you confirm that you are able to use what has been provided before you?
Sure.
Okay, do you have any question for me? Are you fit and well to start?
Sure.
Alright, good. So your time starts now.
Knock knock.
Hello.
Hi. My name is Nostata and I'm here to administer your insulin injection subcutaneously. Are you expecting me?
Yes.
Alright, then am I in one chosen any longer with you?
Of course, yeah.
Can you tell me your full name and your date of birth when I proceed with my documents?
Daily Council, 10th of 1st, 1987.
Alright, I'm here with me, Mr. Daily Council, and date of birth is 10th of 1st, 1987. I can confirm I have the expressions. What would you like me to call you?
You can call me Council.
Alright, Council, can I come in?
Of course you can.
Alright, can you confirm is there any pets or kids that might hinder this procedure?
No.
Alright, so I'm going to come in. And you can see that the scene is safe. I'll close the door and draw the consent to provide privacy and dignity of consent. See, I would like to perform an hygiene.
It's just on the table.
Right, I'm going to apply an ample amount of gel in my hand and I will count to pound. Perform an hygiene calling of the 2 candle, count to pound, 5 pound over left and vice versa. Fingers interlaced, fingers interlocked and vice versa. Sharp rubbing of the palm and vice versa. Fingertips, sharp and vice versa. Sharp rubbing of the wrist and vice versa. Allow my hands to dry for 30 seconds and my hands are looking. Alright, lady, like I said, I'm here to administer your insulin, prescribed insulin medication, which is going to be given subcutaneously. But before I go ahead, I would like to ask, have you got any allergies?
No, I haven't got any allergy.
No allergies, I can see no documented. I don't have allergies to anything. Are you currently in pain?
think I got a bit of pain.
So where is the location of this pain?
Just in my lower abdomen.
So sorry about that. On a scale of 0 to 10, 0 being looking 10 being the highest, and score it for me.
That would be a score of 2.
Score of 2, so that's fine. Do you mind I reposition you?
Yeah, I can reposition myself.
You can also do some big breathing exercise. But don't worry, I'm going to, after the procedure, I'll check your medication chart if there's any G prescribed analgesic, or next time there's no necessary to put in mind.
Thank you, nurse.
Thank you. So I'll just go ahead and get my equipment. In the meantime, if you need anything, you can just give me a shout out, okay?
That's fine.
Thank you. Assessor, I want to confirm if my tray is disposable or usable.
Yeah, disposable.
Perform energy. I can see that it is clean, visibly clean, and I'm happy to use. So I have my equipment here with me. I have the balls. I can see that it's clean and it's intact. The expiring date is on the 8th, 2027. I'm happy to use. I have the clean air wipe. I can see that it's clean, intact, and in date. The expiring date is 2026. I'm happy to use this. I have the insulin needle. I can see that it's clean, intact, not broken. The expiring date is on the 14/9/2026. I'm happy to use this. I have the insulin pen. I have to cross-check my document to be sure I have the correct insulin. Is insulin humidin? No. What is prescribed is insulin number. Alright, I have here with me insulin number. I'm going to be giving subcutaneously. Expiring date is on the 31st/8/2026. I'm happy to use this injection. I can see that 12 label with and date of birth is on the 10th/1st/1987. I can confirm that this is for the vacancy and I'm happy to use. Examiner, can you confirm if it's stored in a room temperature?
Yes.
Alright, I'm happy to proceed. I have here with me the sharp box. I can see that it is less than 1/3 filled and I'm happy to use. I'm going to perform my hygiene again. Following the WHO standard. Alright, lady, I'm back to administer a prescribed insulin injection. Is that fine?
Yep.
Alright, Consi, thank you very much. So I'm just going to go ahead and read your prescription to be sure that it's valid, legible, and signed. I'm going to follow the rights of medication. Is that fine?
Yeah.
So I have here with me Miss Lady Consi, and address is 1000 Avenue. Your date of birth is 10/01/1987. Allergies, you don't have any allergy. You don't think this insulin and those and votes is 15 units subcutaneously. The name, signature of the doctor is present, Dr. Jim Gray, and the date is today. I have here with me, I'm going to be signing my details after the procedure. Is that fine?
Yep.
Before I go ahead, Lily, have you eaten anything?
Yeah, I've had some food.
Alright, what is your current blood glucose level?
I think it was 12. Yeah, 12.
It was 12.
12
milligrams. That's a bit on the high side. I believe that's why I'm here to give you your insulin. Is that fine?
Thank you.
Subsequently, I'm going to be there to monitor the trial procedure, okay?
Thank you.
Alright, I'm going to follow the rights of medication. I'm going to ensure I administer to the right patient, the right drug, the right dose, the right routes, right date and time. I'm also going to ensure that it's the right guidelines. Is that fine?
Yep.
Alright, then some of the possible side effects of this medication is most notable side effects is hypoglycemia. Other side effects can include nausea, vomiting, hyperlipidemia in the area if it's not being treated. But not to worry, I'm going to be there to monitor the trial procedure. Are you standing for me to proceed?
Yes.
Alright then, thank you. So I'm just going to go over and wear my gloves and apron. And go ahead with the procedure, alright?
Thank you, nurse.
Thank you. So I'll perform my hygiene again, following the WHO standard. Some of the possible signs of a subcutaneous insulin injection is your upper arm, your lower arm, and your upper arm, the thigh, and the lower abdomen. So where would you like me to give you an injection, Mercy?
Yeah, I think I can use my upper arm.
The upper arm?
Yeah.
Alright, then that's fine. Where was the last time they gave you an injection?
That was on my lower abdomen.
The lower abdomen. It's very important to rotate the side, alright?
Thank you.
So I'm going to assess the sign now for signs of infection.
Yeah, you can assume this will be the upper arm.
Right, thank you. So I'm assessing the site. I can see that there is no redness, no swelling, no bruises, no signs of infection. I'm happy to proceed. Had it been expecting, I'm going to clean it with my cleaning wipe for 30 seconds and allow it to dry for 30 seconds. But since it's visibly clean, I'm going to go ahead and give the medication. Is that fine?
That's fine.
Alright, thank you. So I'm going to take my injection and confirm it again with my prescription to be sure I have the correct medication. I have here with me insulin and IV, and the dosage is 15 units subcutaneously, and it comes 100 units per meal. And the expiry date is on the 31st, 8, 2026. I'm happy to proceed. I can see that it's clean, intact, and it's the date I'm going to be giving the medication. I'm going to take off the cap. Also take these off thoroughly without touching key parts. Touch it clockwise manner. I'm going to take the cap off and discard this immediately inside the pin OSB. I'm going to set this to 2 and prime to remove excess air and to be sure that it's working. 2, prime. Then I can see that insulin dropped from the middle. I can confirm that it's working, and I'll remove the excess air. So I'm going to take it to the required prescribed dose, which is 15 units. So Assessor, can you confirm it's 15 units?
Yeah, 15 units.
So I'm going to give this subcutaneously, the correct route, subcutaneously, and I'm going to pinch the skin and go at angle 90. I'm going to give for 10 seconds and wait for 10 seconds. Are you happy for me to proceed, Consi?
Yep.
So I'm going to pinch the skin and make a fold. At angle 90, I'm going to give the medication. I'm going to give for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm going to wait for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm going to withdraw immediately. Unscrew this immediately and discard inside the sharp box and cover the block. Alright, sorry, here's the gauze. I'm going to apply this gently. Do not apply pressure in order to prevent tissue damage. Is that fine?
That's fine.
So sorry about that. I'm going to remove my gloves and apron and discard inside the clean waste bin and document what I'll give it. Alright, Consi, how are you feeling?
Yeah, I'm okay. I'm coping well.
Alright, I'll perform hydration for documentation. I'm going to drag for 30 seconds and I'll document. Alright, Consi, thank you very much for your time. I'm done commencing the prescribed medication that I just gave. In the meantime, I'm just going to go ahead and get my equipment clean and calibrated. I'm going to take the medication back to the medication cup and it's to be stored in the room temperature. I'm going to discard every other thing inside the clinical waste bin, including the tray because it's a disposable tray. Is that fine?
That's right.
I'm going to discard this inside the clinical waste bin. Alright, how do you feel now?
I'm much better. I'm cleaner.
As some of the possible side effects, like I said, is hypoglycemia. So, possible as some of the signs of hypoglycemia is maybe you might be sweating, you might feel dizzy, blood vision. If you have any of those signs, if you can have juice, you can just drink it, right?
Yeah.
I'm also going to encourage you to eat something as you find. Is that fine?
That's fine.
So, in case of any emergency, you can call 999. But if it's not emergency, you can contact the GP. I believe you have the GP's number.
Yep.
Alright, thank you very much for your time. Do you have anything for me?
Not really. I'm fine.
Alright, then I'm going to come back and monitor for the effectiveness after 30 minutes, alright?
That's fine.
Thank you. I'm going to end the session with some hygiene, following the standard. Now my hands will drop 30 seconds, my hands.
Thank you.
Thank you.
Thank you so much. So we do hope you learn something for this scenario. I just want to show you a few more things before we call it a day with you today. If you do have any question that pops up across your mind in the course of watching this video, don't hesitate to pop it on the comment section. We'll be more than happy to get it clarified for you. Now, the few things I want you to observe was when he was calling for the patient's identity, he did not bother to be saying, tell me your full name, then tell me your date of birth and so on and so forth. He just said, can you tell me your full name and date of birth? So you know this is a timed exam. You want to do everything that you can to ensure that you meet up with the time. So name, full name, date of birth so that the patient can give it to you all at once. So I hope you also observed that he actually began by reading the scenario. So by reading your scenario, you will be able to know whether you are dealing with community-based scenario or you are going to be dealing with hospital-based scenario. If you don't read your scenario, your approach may actually be wrong in your OSCE. So at EMGS OSCE Masterclass, we want to ensure that everything is done right, no stone is left unturned. Now, part of the thing I also highlighted in the course of his demonstration was the fact of audibility. Now, you need to be audible when you are dealing with your OSCE exam. Now, you may want to know why do I need to be audible? What is Mr. Taibe saying? Actually, if you are not audible in your exam, if for any reason the assessor happens to notice that you missed something and he wants to go and review to see whether you actually got it, your audibility may fail you. So we don't want that for you. So be audible. You have prepared for this exam for a very long time. So you want to show everything that you have actually prepared over time. You have just one time to show it. So why not give your best and give your all? So please take note of that. Now, I want you to also observe that in the course of this demonstration, there were different insulin needles. Now, let's start from the insulin needles. And these are your insulin needles. So I'm just picking this up just to show you an example. There are 3 different types of needle right here. So if you look at this very well, this is very, very advanced. So with this type of needle, it has its own safety lock. So what that means is, before you can go ahead to administer, so let me just quickly demonstrate with you. So look at this now. This is the insulin needle and the expiring date will be somewhat here. So when you take this off and then you screw this in, observe, you screw this in and then you take the cap off, you will observe very well that you cannot see any needle anywhere. You can't see any needle anywhere. But by the time you are administering to the patient, obviously the needle will come out and it will retract on its own and activate its own safety lock immediately you are done. So this is very, very advanced. So you don't know the needle you can find in your assessment day. So we always recommend that before you go ahead and write your exam, always come for the physical assessment so that you can be able to get yourself acquainted with whatsoever you can find. You don't want to be taking on away. You don't want to hear that because of not being able to handle equipment, that's why you go and disappoint us. So you don't want that. Everything must be done right. Now, if you also observe very well, this is another type of needle. You can see this is another type of needle, and this needle kind of have double protection. So if you, let's say we activate this now, the same pattern, if you take this out, you will see that there's another covering. So if you are not used to this type of needle, now you may just go to the exam and go ahead and start administering medication to the patient. But you need to take this off so you can see, before you can see that, okay, here comes the needle I'm going to use to administer. Remember, whenever you take off, you are not supposed to what? Recap. Always take note of that. So for this case now, we are going to discard into the sharp. So another type of needle you can also find is this. So this is also different from the rest that I have shown you so far. So if you look at this very well, you see that the needle will pop up. So you just need to go ahead and administer after you are primed, just as he demonstrated. So please take note of that. At EMGS OSCE, we don't want to hear story. So we want you to be able to use all the equipment, to be able to get familiarized with everything that can come so that nothing can take you unaware. So if we unscrew this now, this is supposed to what? Go straight into the shaft. Now, I want you to also observe that this shaft is different from this shaft. So this is the shaft you might be familiar with. On your exam day, you might find this type of shaft. You might find this type of shaft. If you find this type of shaft, we will unscrew, as I have told you before, unscrew, and you withdraw. However, if you find this type of shaft, all you need to do is, you don't need to use your hand to be unscrewing. Let's assume it's like this. So the whole thing will just enter into this. So this has its own, see, it has its own space where this thing fits in, and then you can just unscrew, slow. And you see, it's all done. So the thing falls into that. So please take note of that. You don't know the type of sharp you are going to find. So we don't also want anything to take you unaware. Now, part of the things I also documented was the different insulin pens. Now, if you look at these insulin pens, they are both different. So if you look at this, let's cover it up now. If you look at this, if you open it, it will be very clear. But for this, you see, it's a bit cloudy. So for this cloudy one, you may need to scroll with your hand just to ensure that it's properly mixed before you go ahead to start administering. So always take note of that. But for this that is clear, always verbalize that it's clear, there's no precipitate, and you are happy to use that. So please take note of that. Now, part of what I also documented to further enhance your preparation was the fact that you have to always remember the right of medication administration. Right patient, right drug, right dose, right to right time, right dialysis, if it's liquid medication. So you must not forget and always remember the BLS of EMGS, validity, legibility, and signed by the prescriber. So by now you already know the EMGS has physical assessment center available to you both in the UK and in Lagos, Nigeria. So I want to hold you by your hand. Whether you are just a beginner or you are already an expert and you just want to perform, we will be more than happy to support you. We have heavily subsidized our services to make sure that you have the opportunity to acquire the necessary skill to be able to qualify as a UK alum. And leaving that aside, even if you are a person that have a very busy schedule, and that is the reason why you feel you will not be able to get your journey on track, we got a package one-to-one for you where you will be able to have an assessor that work with you online and offline. You know that you are well taken care of. Now, let's go back to part of the tips that you should be aware of. Now, you will also observe that when he was administering the insulin or the medication, rather than him administering on the upper arm, I told him that the skin is right here for him to use. So in your OSCE center, there are different types of skin you may find. So you may find something like this. This is somewhat like a sort of a skin. I will also show you some other example of skin. There are different types. These are all skin. You can see these are all different skins. Sometimes the skin can be attached to the arm of the patient. Another time it could just be on the tail. So it's left for you to now analyze what you do. And then when you are giving the insulin, you can decide to make a fold of the skin if the patient is one that has a very thin body. Or if not, you will not necessarily make a fold. But it all depends on the size of the patient. But just to say, just make a fold and assume that the patient has got a thin skin, and then you go ahead and administer subcutaneously. Remember, insulin administration is one of the only medication that subcutaneous administration has to go at 90 degrees. Usually, all subcutaneous administration go at 45, 90 degrees straight, while 45 is just like this. So please take note of that. Now, another thing you will observe is that he confirmed the blood sugar of the patient. So you cannot administer insulin without checking the blood sugar. It's like during implementation. You cannot be administering blood pressure medication without checking the blood pressure. So you can also be administering blood sugar medication without checking the blood sugar of the patient. So you cannot be giving insulin without checking the blood sugar of your patient. So always take note of that. Now, you will also observe that in the course of his demonstration, his glove and apron were taken from here. So you don't need to be confused. You can see large, medium, small. So it all depends on you, depending on what you see available on your center. Some centers may just have all the apron and glove available to you right on the table, while some will have all the equipment standard, just as it is with EMGS physical assessment center. So we don't want to leave any stone unturned. We want to be part of your success story. And also observe that when the patient was in pain, he didn't just say, "Are you in pain?" He went for that to say, "Where is the location of your pain?" And then he says, "Call the pain for me." Remember, EMGS always let you know that every pain deserves LS. L is for location, and S is the score. You have to know the location of the pain before you can what? Go ahead and score your pain. So I hope you are also taking note of that. Now, with that being said, I believe that this session was helpful to you. If you have come this far, I believe you have benefited from this video. Why not give the video a thumbs up? Also, subscribe to the channel. If you have your colleague that are also on the same journey with you, you can share the video to them. Let's help them to be able to smash it, to be able to celebrate and be a part of their success story. With that being said, I'll be calling it short for now. Hopefully, we'll be able to see you in our next video, and we'll be able to see you in our physical center. Whether you need it online or you need it physical, whether you are coming from Nigeria, Ghana, UK, India, anywhere, we want to hold you by your hand and ensure that you are successful on the journey. I'll see you in the next video. I'll sign out.